Hello and welcome to the very first episode of the CIHE Insider, your unique path to healthcare careers. I'm Dr. Amira Clemens, the founder, CEO, and director of the Cultural Institute of Health and Education, also known as CIHE. I'm so excited to have you here today as we kick off this new podcast journey together. At CIHE, we believe in the power of education to transform lives and to open doors to meaningful, impactful careers in healthcare. Through this podcast, we'll share stories, insights, and resources to help you navigate your own unique path to a rewarding healthcare career. So now I'm going to do a little introduction of myself and the CIHE's mission. Those of you who have attended an info session or had an opportunity to hear my story, this will sound familiar, and this will also allow you to understand that what I say is real and not scripted or manufactured for likability, but it really is my story, and the story doesn't change. See, I grew up in Philadelphia during a time where people barely got high school diplomas, much less a college degree. But I knew I wanted to go to college. I didn't know what I wanted to be when I grew up. I just knew I wanted a college degree. I also grew up impoverished and didn't have many options or opportunities to gain this college degree that I knew that I wanted so deeply. I started to look at options to gain this college degree. One of the things that I did was looked at going into the military. But when you go into the military, you can't just decide what it is you want to be or to be educated in. You had to take an assessment that would determine your strong points, because the military wasn't just going to pay for you to play around and waste time and money. I took this test called the ASVAB test, and the ASVAB test helped me to determine what my strengths were in life. See, I did really well in my sciences in high school. I scored high in those areas in the ASVAB, which stated that healthcare was a strong point for me. I didn't go into the military, but I used the information from that to guide my career path. When I graduated high school, I went to school to become a medical assistant, and I did really well because, again, I did well in my science classes. And when I got into the medical assistant program, I soared through straight A's, did really well. I even got hired at the clinical site where I went to get my clinical hours. But I felt unfulfilled, and I went from job to job early in my career as a medical assistant. Not because I was seeking more money or looking for a dream job as a medical assistant. I just felt unfulfilled, and sometimes when I switched those positions, I actually took pay cut. Eventually, I landed a position working for the city of Philadelphia at one of the health districts. And because I was a medical assistant, anyone listening is familiar with what medical assistants do. They have a lot of hands-on vocational skills in healthcare, so much so that they get confused as being nurses. So I was working at this big health center that was like a community center in the heart of North Philadelphia. And because I was so versatile, I would be placed in different sections of the health center every day that I came to work. I had experience with working in the lab, drawing blood as a phlebotomist. I worked in the pharmacy as a pharmacy tech. I worked in adult health, the HIV clinic, the pediatric clinic. I worked in the women's health clinic, maternity. I think it was Hanneman Hospital and Penn Medicine that had specific days that they would come to the clinic and see the pregnant women and provide them with care. I worked in a file room, and I also did supplies for the institution. And one day I was working in supplies, and the supply area was where the director's office was. And she asked me why didn't I go to school for nursing, because at the clinic I had more skills than the nurses did, as the nurses would just do simple tasks like triage and vital signs on the different teams, adult health, pediatrics, women's health, etc. And she noticed that I had a lot more hands-on skills than they did. I told her I didn't go to school for nursing because I didn't have any money to go to school for nursing. So she told me that she would help me go to school for nursing. And the other thing about the clinic is it was a location where the Community College of Philadelphia would do clinical hours for their community clinical rotation. She told me that she would help me go to school to get my nursing degree. The first thing she did was help me apply for community college and financial aid. And because at the time I had been out of school for nearly 10 years, because I was in my late 20s at this point, I wanted to take a class at a time to make sure that I had a good grasp of being a college student, because I would have been a non-traditional student. But when I got into community college, I did really well, even though it was prerequisites like your English and your math and high school science I had to take over again. I did well, so I ended up starting to take 2 classes at a time. And then it came time for me to apply to get into nursing school. And at the time, which was the early 2000s, Community College of Philadelphia was one of the best nursing schools in the country. Even though it was a community college, it was number 2 in the country. It was difficult to get in and very competitive. I applied to 2 nursing programs, and I ended up getting in to community college, which I couldn't believe it when I got the letter. And it was funny because I was going to school with one of my colleagues at the clinic, and she actually didn't get accepted. And it was, both a happy and sad time for me, because we were sure we were going to go to school together. But when I got to community college, I did really well because, again, I was a medical assistant with a lot of skills in healthcare already. And it kind of came easy for me. But what I didn't know was there was a professor at the community college who worked with a professor at Thomas Jefferson University who wrote an NIH grant for minority nursing students. And the grant was called Project Impart, and it was written stating that minority nursing students aren't as successful as their white counterparts because doors aren't intentionally opened in the same way. They received this grant. They received multiple grants, but they received this grant, and I was able to participate in Project Impart. And what Project Impart gave individuals who participated was 1 bachelor's level class at Thomas Jefferson University and 1 master's level class at Thomas Jefferson University while completing a nursing program at Community College of Philadelphia. Also note that when I went to nursing program at Community College, I just knew I was going to be a nurse, and I was going to work in a hospital, and I was going to take care of patients. That was it. I didn't even think that there was anything else you could do as a nurse. But another stipulation with this grant was to expose these individuals to other things that they could do in nursing. So we were able to attend multiple conferences in order to network with individuals in healthcare, specifically nursing, to be exposed to things that we can do in nursing outside of taking care of patients on a hospital floor. From that group, I believe there was 2 or 3 of us who was selected, once we completed, to compete for a grant for a full scholarship to obtain a bachelor's degree in nursing with a monthly stipend of $500. And I was one of the ones selected, and I received a scholarship from the Independence Foundation. And I graduated in 2004 from Community College, Philadelphia, with my associate's degree in nursing and also another associate's in art. And in 2005, I graduated from Thomas Jefferson with my Bachelor's of Science, which was 9 months after I completed the associate's in nursing at Community College of Philadelphia. Now, also at the time, because Community College was one of the best schools in the country, there was a lot of hospitals that would hire CCP nursing students or new grads straight off the bat without even thinking twice about it, because they were really good nurses. And at the time, Presbyterian Hospital in West Philadelphia had just merged with Penn Medicine, and they were recruiting for new nurses, and they came to community college to recruit individuals from the cohort that I was graduating with. And they offered us a $10,000 signing bonus, and I said, why not? The only requirement was that we would work for them for 2 years and we wouldn't have to pay any of the $10,000 back. So I'm graduating in 2004 with a full scholarship, a $500 a month stipend, and a $10,000 signing bonus. I was living the dream. Also, Penn Medicine had really, really good education benefits, and they would pay for 2 classes a semester straight out as long as you received a C or better in the classes that you took. So after graduating in 2005 with my bachelor's degree, I started taking non-matriculated courses towards my master's degree at Thomas Jefferson University. Also, while I was at Thomas Jefferson, I applied for another scholarship and got my last semester paid for through this scholarship. And if you're keeping up with the story, as I always say when I tell the story, at this point, I was reluctant to go to school to become a nurse because I was afraid that I wouldn't be able to afford to pay for it. And here it is, I am almost finished a master's degree and hadn't paid for school yet. I finished my master's degree in 2009, and with degree in hand, I was invited back to Community College of Philadelphia to work as a clinical instructor, making more money than I could even fathom. And life was amazing. I was working at CCP, and CCP didn't have summer courses. So in the summer, would either go back to working full-time at the hospital, because I went part-time at the time working at Presby, and I didn't want to go back to working full-time on the floor. Even though I loved it, it was something that I was planning to eventually pull away from. I felt like I did my time on the floor and I needed to get back to nursing in a different way. I was at another conference and expressing that I needed to find something else to do during the summer because I didn't want to go back to working on the floor. And one of my colleagues encouraged me to go apply at Drexel University and assured me that Drexel would hire me. And sure enough, I went to interview at Drexel and I was immediately placed on the schedule during the interview. And I started working adjunct at Drexel in 10. And I was invited to compete for a full-time position as a professor of nursing in the College of Nursing and Health Professions at Drexel. And I was hired And the stipulation for accepting that position was that you can work with a master's degree for up to 5 years. In your 5th year, you had to at least be enrolled in a PhD program. I was hired in 2014, and by 2019, I had to be enrolled. Although this was a stipulation for them, I did want to get my doctorate, but I was following their rules, and I allowed myself to work as a full professor for the allotted time before I went back to school. And 2019 was the year that I had to do it, and I hadn't found the program that I wanted to be in yet. But I affirmed in January of 2019 that by September of 2019 that I would be in somebody's PhD program. 1 month later, someone walked into my office looking for another person and found me, thinking that I was her because she only communicated with her by email, and started to talk to me about something I knew nothing about, and apologized and introduced herself as someone who worked in a PhD nursing at Drexel, and asked if I knew that they had such program at Drexel, and I told her no. And she asked me if I had a PhD, and I told her no. And she asked me if I wanted a PhD, and I said yes. And she asked me, well, what's stopping you? And I said, to be honest, I haven't paid for school yet. I didn't want to pay for the most expensive degree. And she asked, well, what if I can get you a full scholarship and a stipend? And I said, I'm listening. And by the end of the day, I had applied for the PhD in nursing program based on the conversation I had with her. And the stipend was for $2,000 a month. And in 2023, I graduated with my PhD in nursing from Drexel University's College of Nursing and Health Professionals. During my time as a full professor, which freed up some of my time, a goal of mine came to fruition. And when I was in my CCP nursing program, one of my classmates and I always talked about opening a CNA program, because we wanted to make a difference in CNAs and how people view CNAs, especially as women of color. And it took me that long and to free up my time to bring that dream to fruition, and also to learn how I was going to do it. And because I even though I was full-time, I've had enough time to create and manifest this program that I wanted to manifest. And I went the route of nonprofit because I wanted to create a program that was free to individuals who need it, so that I can be the person that saw things in me that I didn't see in myself. I wanted to be that person for other individuals and provide them with free entry-level healthcare careers to be inspired in the same way that I was inspired, and to achieve the things that I achieved becoming a nurse with a PhD. I dedicated my career in healthcare, education, and in community impact. And I founded CIHE to create opportunities for individuals from underserved communities to access high quality, affordable vocational training. And again, my program is free, and I want it to always be free. There's some things that people have to pay for, but it's very low cost. We equipped our students with the skills and certifications they need to enter in the healthcare field and to make a real difference in the lives of others. Our mission is simple but profound: to empower individuals, uplift communities, and bridge the gap in healthcare workforce development. And we are committed to breaking down barriers and building up the next generation of healthcare professionals. At CIHE, we offer a range of programs designed to meet the needs of our students and the demands of the healthcare industry. Our flagship programs include training in phlebotomy and EKG certification, with more pathways in development to ensure that students have multiple opportunities to succeed. But why healthcare? because it's one of the most rewarding and essential fields you can choose. Healthcare professionals are the backbone of our community. They save lives, provide comfort, and ensure that everyone has access to the care that they need. And let's not forget, healthcare careers offer stability, growth, and endless opportunities to advance. Whether you're just starting out, looking for a career change, or seeking to deepen your skills in healthcare, then healthcare is the field where you can truly make a difference while building a secure and fulfilling career for yourself and your family. And why did I create this podcast? Well, I wanted to create a space where we could connect on a deeper level, a place to share stories, celebrate successes, and provide practical advice for anyone looking to enter and grow within the healthcare industry. Every episode will feature something new: interviews with healthcare professionals, success stories from students and alumni, and actionable tips that will help you on your journey. This podcast is for you, whether you're a student, a career changer, a healthcare professional, or someone just curious about what it takes to succeed in this field. As we wrap up this first episode, I want to thank you for joining me on this exciting new journey. My hope is that CIHE Insider, your unique path to healthcare careers, becomes a source of inspiration, guidance, and support for you as you take the next step towards your goal. Make sure you subscribe so you don't miss an episode. And in our next episode, we'll be diving into the first steps for building a career in healthcare. Until next time, remember, your path is unique. Your goals are achievable. Your future is waiting. And let's make it happen together. Thank you for tuning in.